The National Mental Health Program of the Ministry of Health, in collaboration with the World Health Organization on Thursday, 22nd February 2024, held a day-long orientation for journalists on the draft mental health bill, as the orientation was done at the Siam Conference Hall in Kanifing. Part of the orientation's aim is to fight against the burden of mental health in the Gambia by sensitizing and discussing with the members of the press on way forward for mental health advocacy, as they are the key mediators between the unit and the public. Speaking to the journalist, Momodu Gassama, health promotion specialist at the World Health Organization, said the world is not doing enough for mental health.
The world is joking. I want to say the world is not doing sufficiently enough for mental health. Because as we speak now, 1 in every 8 person has a mental disorder. Which means 1 billion of the world population has a mental disorder or mental health condition. This is serious. One in every 8 person in the world has a mental health condition. So where are we? This is far more than the malaria we are talking about, far more than, HIV/AIDS, far more than tuberculosis, far more than other conditions. But yet, those conditions are getting the resources they need. They may not get everything, but where is mental health now? 1 in every 8 person in the world has a mental health condition, or call it a mental disorder. 1 in every 8. What is the world doing about this? If you talk about it, all the health ministries together in the whole world compile all their health budgets together. Only 2% of health budgets go to mental health globally.
Gassama also said that human resources capacity for mental health is inadequate, adding that in terms of services, nearly 50% of people with chronic mental health conditions do not have the services they require. Mamjar Marega, the program manager of National Mental Health Program and double as a psychiatric nurse, said mental health is one of the basic human rights regardless of age, gender, religion, status, among others. She revealed that mental health conditions are the leading cause of disability globally.
Now, depression is one of the leading causes of mental disability globally, and suicide is the 4th leading cause of death among 15 to 29-year-olds. Now, WHO has stated that 1 in 4 people, how many of us are here? We are many, right? 1 in 4 people will experience a mental health condition. It could be once or twice in their lifetime. To further break this down, 1 in 3 women and 1 in 5 women will experience major depression. When we say major depression, because mental health conditions have different categories and levels. We will categorize them on a mild, moderate, and severe. So WHO is indicating that 1 in 3 women and 1 in 5 men will experience major depression. So that means it's more common in women. And you know, women, we are part of the vulnerable group. We, the children, the elderly. And again, 1 in 7 children between the ages of 10 to 19 will experience a mental health condition. So all this is significant, because looking at that age category is really, really critical. 10 to 19, the adolescent gap. And these are going to be the people that are going to serve the nation tomorrow. So if we address the burden of mental health, and we cannot do it alone. Our program under the Ministry of Health coordinates all the mental activities in the country. However, we cannot do it alone because we are resource constrained. The human capacity is very, very low. And that is why we call it here today to have a discussion.
Matron at Tanka Tanka Psychiatric Hospital, Bakari Kamara, highlighted some of the challenges they face.
What is killing us here in the country is the stigma and the discrimination attached to the mental health individuals. Even to the service givers, not only the service users, even the service providers are also being stigmatized and they have been discriminated too. So this is why sometimes if you go to Tanka Tanka, some of you who knows Tanka Tanka, this is why if you go to the hospital, you will not see the hospital label there Tanka Tanka, apart from on the main highway. That is only where you see the tabla. But if you come at the hospital gate, you will not see it written there, simply because some of the individuals, when they are passing by, they say, female, Keri Duffy. So what does that mean? And then let me tell you this. even the mentally ill individuals, if you call them mad, they won't like it. They don't like it at all. You tell them mad, they will tell you, no, man dofuma, I am not mad. So why are you calling me mad? So most of the time, these are the words we will always want the mass media or the, how do you call it, the televisions or whatsoever communications we are using to be filtering out without, in a civilized way, without using those stigmatizing words.
Through the discussion, the unit assured the journalists of their willingness to work with them and urged the journalists to use their platforms in informing and educating the public about mental health conditions while writing successful stories of people with mental health disorder. They also assured that they will be doing their best to make sure that the mental health draft bill, which has been pending for 5 years, is enacted to become an act for the benefit of all. The National Mental Health Program is a unit under the Ministry of Health responsible to coordinate and facilitate all mental health activities within the Gambia. Reporting for N24 TV, I am Fatou B. Kamara.